Ever since the 14th century, dental tooth extractions have been feared by both the patient and the surgeon. You see these old paintings depicting extractions as these barbaric procedures where it seems like you're just causing a ton of trauma and pain to the patient. However, as I observed more oral surgeons work, I realized that they used minimal force and relied on technique, finesse, and precise instrument placement. Now, me, I consider myself a gym bro. I love working out, and early on, I was getting a lot of teeth extracted by simply just muscling them out. But this was giving me a false sense of confidence because inevitably I was breaking buccal plates and snapping off crowns in the process. I was causing more trauma to my patient. And to be honest with you, at times it felt that I was being a little too aggressive. However, at the moment, I didn't know any better and I would do anything I could at the moment to take that tooth out. 1,000 teeth in 9 months is no joking matter. This is my bread and butter at this point. This is what I do most in my practice. I do work for a corporation where it's mainly extractions and dentures, and unfortunately people here choose to pull out of their teeth instead of saving them. The demographic I work for is very conducive to poor oral hygiene, and a ton of full mouth extractions are coming into my office all the time. But as time went on, I realized that I just needed to adjust my surgical extraction technique. And in my surgical extraction CE course, I realized that a lot of the force generation from my body was coming from all of the wrong places. Now, instead of relying on my fingers, wrists, and forearms, I use my elbow and my shoulder in strategic ways when I'm taking out bigger teeth like molars. Now I use more of a figure 8 motion and generate power from my elbow and shoulder. It really helps me achieve better results. Guys, understanding the appropriate forces required for different types of teeth is absolutely crucial. For anterior teeth, a gentle rotation of the wrist and fingers is usually enough. Since the roots are conical, the anatomy is conducive to more rotational movements. However, when dealing with those big molars with several roots, applying more force from the elbow and shoulder to create lateral pressure and apical pressure is necessary. Sometimes it's challenging to see the exact position of the instrument on the tooth, especially when those root tips or teeth are flush with the bone underneath the gums. I remember my first few months, I would be poking at the patient for 20-30 minutes at a time, just trying to get those pesky little root tips out. And those difficult cases forced me to audible my extraction strategy. Now, even though it can be intimidating, I recommend making a flap for root tips and severely decayed teeth. The moment I flap, it becomes so much easier to see the tooth, where the tooth meets the bone, where to put the instrument, and how to take the tooth out quickly. A lot of dentists fear the flap, and I did too in the beginning. If you're not comfortable with flaps, it's a very cumbersome procedure to do. You're fighting the gums, everything's in the way, you're potentially causing more blood to the surgical site. It can be a mess. But I've noticed when you make cleaner flaps, the procedure itself becomes way easier and you're able to take out teeth way faster. I really began perfecting my flap technique while taking out impacted wisdom teeth. Once you tackle the harder impactions, you will realize how essential proper flap design becomes. At first, I used to only grab the visible parts of teeth, but now I know the importance of grabbing the tooth as apically as possible on solid tooth structure. By reaching below the gums and getting a better grip on the tooth, you're more effectively able to leverage it. Remember, you only need 2 things to remove any tooth. 1, a place to put the instrument, and 2, a clear path for the tooth to come out. Remembering this will help you overcome obstacles such as bony impactions or adjacent teeth during the elevation and luxation process. In my journey as a general dentist focusing on surgery, I've learned some important techniques that can make complex procedures easier and more predictable, and maybe you'll find use in some of them. One key lesson is knowing when to be more assertive earlier on in cases. Mainly what I'm talking about is when we do surgical extractions with bombed out, decayed teeth, or specifically root canal treated teeth. Now, I know in dental school using a surgical handpiece to take a tooth out was a big no-no, but I've come to realize that it's a very strategic tool in specific situations. Sectioning molars or dividing them into smaller pieces can make the extraction less traumatic and more manageable. It's easier to section a tooth in multiple pieces and gently remove it as opposed to grabbing the tooth and yanking on the patient's head for 10 minutes. When I encounter a root canal treated molar, I assess if there's any movement. If there isn't, I immediately proceed to sectioning to prevent any further complications. This technically is considered being more aggressive early on the faster you reach for the surgical handpiece. Back in the day, I used to poorly attempt to luxate and prematurely grab the tooth with the forceps. All I'm saying is if you've done enough of these, you know exactly what's gonna happen. Tooth breaks and the whole procedure starts taking a complete different turn in the wrong direction. In some cases, I may remove a small amount of bone to create a better grip on the tooth. And if it's a root tip on a molar, I'll remove some of that furcal bone in the center. I'll be able to push it out that way. Try to realize that a lot of the time these root tips are held up by the furcal or interseptal bone. But guys, I'm definitely avoiding any reduction in buccal or lingual bone at all. I'm sure if you've seen enough of these teeth or you've done enough of these extractions, you can see exactly why dentists are afraid to do surgical extractions. It's so unpredictable, and I get it. But with enough practice, you can predictably remove these teeth in a fast amount of time. After gaining experience from over 1,000 extractions, I developed my own system. Observing oral surgeons, I noticed that they followed a very specific sequence of instruments. This allows for a smoother workflow. If you've ever seen them working, they put their hand out, their assistant knows exactly what tool to be in their hand because they can predict each other's movements. But by understanding these techniques and developing your own systematic approach, you can navigate surgical procedures with much more confidence and achieve faster results. Let's look at an example. What to do when dealing with a severely decayed mandibular molar. I always began with separation of the gums with my favorite oral surgery tool of all time. If you guys follow me by now, you should know what it is. Carl Schumacher's Spade Proximator. Then I proceed with luxation and elevation, attempts with the gold luxator and the 301 elevator. I'll insert the luxator between the tooth and the bone. I'm always aiming as apical as possible, trying to create some separation and mobility. Now, in my hands, I found that switching tools and trying different angles for no more than 15 to 30 seconds at a time has greatly improved my efficiency. You really have to feel it out and listen to what the tooth is telling you. If there's minimal movement, class 1 or class 2 mobility, I'll try to use a forceps 23 or 151 to see if it can be removed easily. And in these early moments, I avoid being overly aggressive, as snapping the crown can complicate the procedure. But if the crown snaps, leaving root tips in the bone, no big deal. I'm proceeding to make a flap with the 15 blade to gain better visibility, like we talked about. It's essential to understand the tooth's anatomy while paying close attention to the root deflections. This intuition will grow stronger within you over time, and you'll be better at sensing the direction the tooth wants to come out. See, before I start any extraction, I already have the steps in my mind before even ever touching the tooth. This type of pre-planning is crucial, especially in complex cases like wisdom teeth. In these cases, you need to know exactly where to section and identify exactly what's holding the tooth in the bone. So if nothing is moving on the tooth when I'm luxating and using forceps, I'm proceeding to section the tooth using a drill. And I'm ensuring that when I section a molar, I'm drilling all the way down into the furcation. I'll drill deep enough so that when I get that elevator in the tooth, it'll snap it right in half. Early on, I would be so afraid of sectioning all the way down the tooth that I would do a partial section, and then when I went to put the elevator in it, it would snap part of the crown off and leaving the root tips in the bone, making it more complicated later on. After doing these enough times, you realize drilling a bit deeper is not the end of the world if you're able to get the tooth out in a fraction of the time. And when I was just starting out, I was being ultra conservative, as you should, but I would never reach for the handpiece, I would never try to section teeth, only to constantly be stuck in these surgeries for 40 minutes, an hour at a time, trying to take a tooth out just using an elevator in a different way. And just like that, nothing would work, and you realize that you need to be able to remove bone strategically to get teeth out. And if you want to see my detailed approach to tooth extractions, reach out to me on IG. I can share the file with you and we can have a conversation on what you may be doing wrong. Now, I can detail my systematic approach if it'll help you as well try to understand what you need to be doing in these surgical procedures. I recommend experimenting with each instrument in your armamentarium and understanding its specific purpose for specific situations. For example, there's a tool called the Crier or the East-West, which I never understood at first. But when I learned to use it interproximally to remove a distal root tip through the furcation, I realized it's one of the best tools out there for root tips. Similarly for thin root tips, a root tip pick, a really thin one, can be great at getting in between the root and the bone, closer to the apex, and have it pop right out for you. These instruments have their place in specific circumstances, so it's crucial to have that mental toolbox when you need it. Okay, confession time. When I initially started, I was so gung-ho and excited to do these types of extractions, but I wouldn't spend enough time to truly appreciate the radiograph. The radiograph tells you so much about how the procedure is going to go, and if you learn to read these patterns, you will be so much better off. I used to encounter difficulties during extractions when a tooth would break unexpectedly, but upon closer examination of the x-ray, I started noticing subtle indications of why that may have happened. I'm talking root deflections and bone quality, which helped me understand the anatomy of the tooth and its extraction path. Understanding the anatomy and bone density is crucial when selecting appropriate instruments and approach for surgical extraction. I'm wishing you all the best. Take care. Dr. Rana here, signing off.